A little bit about informed consent. Now, as always, this is one of those topics. I really do, like I said earlier, I feel very strongly about this, but there's a few different things about informed consent that always seem to get a little bit tripped up. Now, informed, it could be as simple as I know what the procedure is. But do you fully understand the risks and the complications? Do you understand what outcomes there could be, what impacts it's going to have? And when I say informed, I really want you to feel like you know the ins and outs and ups and downs and backwards of all this, which is why, for example, in the induction section, we go through the different types of induction, from the balloon catheter to the stretch and sweep to the oxytocin to the Cervidil to the gel, all of these different things, and talk a bit about them so you know that there are different options. But it's more than just knowing the options, because your individual situation is going to be so unique, which is why I've said, within that course, I'm not your nurse, but I am a nurse. And I mean, yes, in many ways, I get to know pretty much all of you quite well. But that being said, things change. And where I'm not physically present with you, I can't necessarily know all of the things that your healthcare team is knowing. And that is where it becomes really, really important to understand that there is a lot of stuff that, they may know some things by doing a check or having the ultrasound results or whatever. And if they don't say it to you or tell you why it's important to them that, maybe you do the Cervidil versus doing a balloon, doing all of these different types of inductions, just going with that example, then, there are different reasons why. But this is where you come in and really do have to actually, you have to ask, and you really have to be on the ball, because again, like, these providers, as beautifully well-intentioned as they are and how wonderful that they actually are, there is so many people that they see in the run of a day typically, and they have done these things like 100 times probably that week. So they may not go through every individual step or every little piece of the information that you may actually feel like you really want. Having that really good, open, honest conversation with your healthcare provider and how important that is to be able to know exactly what it is that's happening. So there's 5 different steps, like you can see here, on what this idea of the actual informed consent looks like. So first off, there is the nature of the procedure. So what actually is happening? You are having a C-section because then you go through number 2, the risks and the benefits. So the risks are increased bleeding, possible complications with your bladder, possible complications with healing afterwards, higher chance of infection, all of these different things. And your doctor will discuss if there is any individual risks that are higher for you due to, possibly you already having contractions can put yourself at a little bit of a higher risk if you are in labor and having an emergency C-section, increase higher risk of bleeding possibly, or anything else that specifically pertains to you. The other thing too is you want to know what the benefits are. The benefits of having the C-section is that we can get this baby out really fast. They're going to be okay. You're going to be okay. It's a controlled environment, and we know that we're going to be able to do this. There's many different things. And again, like, your individual situation is going to dictate what the actual risks and the benefits are. There's some standard ones that I just kind of listed out, but a lot of the time there's ones that are a little bit more kind of tailored to what is happening with you. So number 3 is knowing what the reasonable alternatives are. So if we do not do this C-section, baby is low enough that we would have the option to do a forceps delivery if you were able to push baby out a little bit lower, but we do need to be able to really get this process moving quite quickly. So you should have some sort of an instrumental delivery. Reasonable alternatives can really be anything, but if you are only presented with one option, then that is not really an informed choice. That is just being told what they think is best, but it is 100% within your right and within the guidelines of actually coming up with this of what informed consent is to be able to figure out what a reasonable alternative could be in that situation, so you have a choice. The risks and benefits of the alternatives have to be explained. So, if we do not do this C-section and we were to go ahead with a forceps delivery, there is potential complications because baby's heart rate is dropping. They may not be getting as much oxygen. There might be increased risk of vaginal tearing. There might be the need for an episiotomy. Benefits could be, you do not have the C-section recovery. You have, you don't have to go to the operator. There is definitely risks and benefits for all of the different situations. And as long as you are being presented with these options and you are making the best choice for you, the last piece of this is you want to have an assessment of understanding all of the other elements. So what are all of the possibilities in this situation? How can this play out and why?